Well, I'm Dr. Jim Del Rosso, the editor-in-chief of the Journal of Clinical and Aesthetic Dermatology. I was just talking with our managing editor, the illustrious Dylan Bailey, about whether we call it JCAD or JCAD. Call it whatever you want. Just read it and listen to the podcasts and other videos that we provide for you at JCAD. I'm very happy today on Friday the 13th, which to me is always a great day, to bring you this review of the 2026 February issue. And this is a great issue, like all the issues. There's a variety of different topics. And one of the ones that I found interesting, it's two case reports of a simulant of acne. And I'm really happy to see these shown every once in a while because it's very easy to miss because you're going in the room on a busy day and you're looking at it and say, oh, these are just some small papules on the face. They're acne vulgaris. But in this case, they weren't. And there's a couple of tip-offs when you want to think of something different. This is an article by Dr. Miguel Aristizabal Torres and other colleagues on multiple miliaria osteoma cutis that were treated with a CO2 laser. And the significance of this is these are very small monomorphic papules involving the face in both these cases in women that are typically older than when you typically see acne vulgaris. One of the women had it at an earlier age. She was 42 years of age, and you can certainly see acne in the 40s or even later. But what was interesting is these are monomorphic. They're small lesions, 1 to 3 millimeter, smooth papules on the face that are firm to palpation. So if you're really stopping and looking at it, you're seeing that most of the time, acne, even if it's comedonal acne, they're not exactly monomorphic. It's not a uniform appearance of the lesions. And that can often be a tip off that you're not dealing with acne. Also, these patients have tried a variety of different acne treatments which didn't help. And these lesions are asymptomatic. They're just there and they just stay and they don't go away. So they turned out to be on biopsy, osteoma cutis. The article shows excellent clinical photographs and histologic photographs, and the histology is going to be distinctive. The problem is the treatment. No, if you try to extract the lesions or incise and do a little shave or saucerization, it's not typically going to be consistent and could leave a discoloration and scarring. These authors review utilizing a laser treatment with a carbon dioxide laser to just lightly stipple the lesions and be able to extract them with good cosmetic results and overall outcomes in one patient. The second patient had not gotten to that point in time, but they had made the diagnosis. So this is an example of something that is not acne that could easily be confused with acne vulgaris in clinical practice. I also want to bring forward the Resident's Corner, which is mastering the science behind the art, how training in clinical epidemiology shapes the future of dermatology. And this is a section, a Resident's Corner, that is kindly supported by Arcutis. But this particular discussion is related to getting training and even master's degrees in clinical epidemiology as they relate to dermatology in this case. And this is by Emily Bomren and Joel Gelfand from the University of Pennsylvania. And it really goes through a very nice discussion as to why you might want to think about, especially if you're epidemiology minded and demographics minded, into how this information helps us understand populations and both diagnosis and treatment. It really is a very good article that goes into, it's not very long, but with good depth, the details that are important and also the workload of different types of courses that you would need to embark on. So I think it really is a very good review of that. And I'm not surprised because pretty much anything Joel Gelfand touches is going to have very good depth. The next article is very timely. It's on glucagon-like peptide 1 receptor agonists, GLP-1s. And that's the big talk, obviously, because of the ability for these agents to help patients lose weight. But it goes much beyond that. In different areas such as dermatology, obviously not only losing weight because people want to lose weight because to look better and to feel better, but also to manage complications of being overweight or sequelae, diabetes that can be associated with it, problems related to obesity. Obviously, very, very important and a very popular area. But in this particular review, there is a group of energetic young authors that Dr. David Cotter, who's a dermatologist I know and work with quite a bit here in Las Vegas. In fact, both of us together are very involved with the Nevada State Society of Dermatology and Dermatologic Surgery. He's the president, and I'm helping on the education committee, but he's very active on faculty at the University of Nevada, Las Vegas, Reno affiliation here in Las Vegas, doing a lot of teaching, and is in private practice at Las Vegas Dermatology. In a short amount of time, he has really become very active in the community and also nationally. So I'm not surprised that he brought a group of people together to talk about utilizing these GLP-1 receptor agonist agents in the management of psoriasis, but also in this paper focusing on hidradenitis suppurativa. So he goes through with these authors, a collection of authors, they did a great job, the mechanisms and why it's important for a variety of different reasons, but looking specifically at psoriasis and then separately in the article, hidradenitis suppurativa, what these agents actually do, not only just in terms of weight reduction, but the impact they have on inflammation. So he goes through the mechanism of action for both psoriasis and then hidradenitis suppurativa and the evidence summary based on the information that we have in the literature. It's an excellent review if you want to get up to date on these subject areas. So now let's move on to another article. And here we have another senior author. Dr. David Cotter was the senior author of that last article. Not so senior, he's pretty young, but he's very senior in terms of his accomplishments already in dermatology. Here comes another one, another young dermatologist that is extremely prolific, and that's Dr. Naeem Issa, who is in practice at Forefront Dermatology in Vienna, Virginia, which is really not very far from Washington, D.C. He's on faculty at George Washington University in dermatology and also at the University of Miami School of Medicine, obviously in Miami, where he has spent some time in the past. So he's very active educationally. So he's gotten a group of young, energetic clinicians available to talk about something that is really very important. And we haven't discussed or heard as much about this in the last few years as we have in the past, but obviously always popular. It's insight into tanning biology and tanning products. So there was a drive for sunless tanning and to utilize self-tanning products. Topical is what we typically thought of, and which many of the products were, but also other means of tanning with injectable agents or oral agents. And this article goes through different agents, and I'll mention them to you because I think they're all very, very important. And what's important about it is not only to look at what they do in terms of tanning without being exposed to the sun, but also what other effects they might have that we don't necessarily think about, but could be problematic. So, one of the first points that's made, and this would be associated with the topical agents, and the two topical agents are dihydroxyacetone and forskolin, which is a plant derived agent, which can be applied topically. Forskolin could also be taken orally. But thinking about it from a topical standpoint, most self-tanner manufacturers do not participate in the contact allergen management program. So if you look at data that people have looked at large numbers of products, usually these studies were over 200 products. The vast majority of them, if not all of them, contained contact allergens that are identified as definitive contact allergens by the American Contact Dermatitis Society. So there can certainly be contact allergens in there of various types that can be leading to contact allergy after the application of these agents. So that's obviously very important. But in addition to the dihydroxyacetone, which is in a variety of different topical products in different formulations for self-tanning, and also the forskolin, which can be applied topically or orally, there's melanotan, which is basically an analog of alpha melanocyte stimulating hormone, which had been used by subcutaneous injection, but they're also making it available in a nasal spray, and also carotenoids, which there have been several, like lycopene, beta carotene, and others that are taken orally. Sometimes those are the ones, some of them will give you the orangey yellow color to the skin. But the bottom line is there is a table in this article, and it's not to scare everyone to think that everybody's going to have an adverse event, but there are some adverse events that are notable that are important with the topical agents, contact allergy, etc., and maybe some other uh, problems that you might identify. But with the systemic agents, some systemic adverse events, and that's in a table, table one in the article. I think this is very important to be aware of. But also, another observation that wasn't necessarily across the board, but surprisingly, with females being overall more aware or attentive to what the damaging effects are of ultraviolet light in terms of skin cancer and melanoma, males are too. But females consistently show more attention to that particular area. They're more likely to use sunless tanning lotions for self tanning, but they were also more likely to then not use other protective measures that you still want to do in addition to utilizing the sunless tanning. Maybe because they had more of a sense that, psychologically, even though most of them would know those sunless tanning agents didn't photo protect them, they just naturally weren't paying as much attention to the other things that you need to do. So it's a great reminder article about some of these issues because obviously proper full photo protection and being able to look tan by another means without harming yourself are both very attractive components. Now, there was another article by Kyle Machinia, who is a physician assistant in Reno, and his dermatology senior author is Jason Hawks. And I actually saw Kyle present this at the Nevada Society of Dermatology and Dermatologic Surgery meeting last fall, and then approached him about publishing it because to me it was such a great presentation and a very well done article on a case of cutaneous lichen planus effectively treated with oral deucravacitinib. And he did. Jason Hawks obviously had looked at the material. Kyle did a great job writing it. And here it is, not that long after, published of a patient that had utilized some topical therapy, but then on oral deucravacitinib, a tyrosine kinase 2 inhibitor that is very selective, had a great clinical response. It's a great case report. So now we're going to move on to summarize a few of the articles, and then we'll wrap up today. The safety and efficacy of aminolebulinic acid hydrochloride topical gel 10% with red light in the treatment of facial cutaneous squamous cell carcinoma in situ. So these were non-invasive squamous cell carcinoma that ranged in size from 0.4 to 1.3 centimeters, 20 patients that were treated with 3 hours of incubation about a month apart for 2 sessions. And all of them cleared 8 weeks after. They were evaluated 8 weeks after, at which time they were evaluated clinically, and also the areas were excised and looked at histologically. At that 8 week mark, they were all cleared of the squamous cell carcinoma in situ. So this is a non-invasive way because you wouldn't excise them if you were doing this in practice, but you needed to for the purposes of the study. A non-invasive way to consider in patients with facial cutaneous squamous cell carcinoma in situ. And these are adult patients. An interesting case. Here's Dr. Cotter again. And this is a very interesting case, also published along with Justine Guzman and Dr. Cotter from Las Vegas, a lead author. What's interesting about it, even though it is a single case report, it's a transient blueberry muffin baby, actually a newborn. They haven't even been alive for one day yet. This was noticed. A neonate that ended up having acute myeloid leukemia. So, blueberry muffin babies, that's typically associated with torch infections, but this one was not. And it might be the only time it was seen on the first day of birth. I don't know. I think that would be extremely rare. But if you're seeing in babies, blueberry muffin babies, right? And the pictures there, as you see here, they actually look like tiny little blueberry muffins on the body of the baby, usually from an infection, a torch infection, what are called the torch group, toxoplasmosis, rubella, cytomegalovirus, herpes viruses, are typically what's associated. However, malignancies such as leukemia have been identified. In this case, it was at the first day of birth. So that was obviously very interesting and brought to your attention by this one case report. Very well written. Next is plant-derived extracellular vesicles in dermatology. This is becoming popular because, as you know, plants are exposed to a variety of exposures that we as individuals, we could go inside. The plants can't, whether it's fumes in the environment, sunlight, weather conditions. Plants are fixed and they have to handle those environmental exposures. Humans can run indoors and protect themselves. So, are there things in plants that we want to derive that we can then utilize in humans that will give us that protection from whatever these offending agents are? So, these plant derived extracellular vesicles are looked at in that regard. And here you're looking at various types. So we can't make a statement about all of them being the same. But in looking at some of the clinical data that was done with rose stem cell exosomes, actually goes through some of the potential benefits on application to the skin that these extracellular vesicles could provide in different formulations. This is a review article that takes you through where we are right now. It's written by someone who is a dermatology resident, has written countless great articles already. I've worked with him. He's a great guy, Joshua Burstein, along with Lydia Majewska, Jason Wee, and Todd Schlesinger, who's well known to us as a senior author, a dermatologist in South Carolina. So this is another review, and I can tell you the JCAD is doing a great job of having very thorough reviews in areas where you can catch up on information in one place where it would be hard to get all this information just going through the literature. Another paper, this is by Maria O'Connor, with the unfathomable how much work Peter Leo does and how much he publishes. And anytime I ask him a question about what he's written about, it's like I wondered, does he really remember this? He always does. It's incredible. And this is on feeding the skin foods in personal care products and the risk of allergy. So the concept here is if you have a formulation that's being applied to the skin and it has some food components in it, and that first introduction into the skin, after all, that's why poison ivy is such a problem. Your first exposure is through the skin early in life, and you develop severe allergy. Now, with other types of exposures with food components, they could become potential allergens, maybe not as egregious as poison ivy, but that initial mechanism to the skin affords the potential increase in allergy. But sometimes the opposite might happen. Certain food components decrease the risk of allergy being developed. Even systemic changes, systemic activation of the immune system. So the thoughts that if you have a peanut exposure early on through skin in some of the different components, you can reduce peanut allergies systemically later. It's that concept. But we don't know enough about which components go in which direction. And I think it's a very important area because if we can figure that out, we may be able to introduce topical products that can reduce the risk in atopic dermatitis patients, for example, of them developing the atopic march. So kudos to Peter and Mara for exploring this. I'll end with a paper that I think this is very interesting in the sense that we are going to have to pay attention to this more and more. I am not a huge fan of artificial intelligence inherently, but I am open to the fact that properly well developed artificial intelligence can be a friend to us. It's when we know what the content is, we know what's behind it, and it's been vetted for us. And this is a paper by um, Nawaz Williams and Jane Yu, Dr. Jane Yu, that is exploring the advancements and applications of AI powered hair analysis tools. So we know that analyzing hair in terms of people being concerned about hair growth, hair quality, cosmetic aspects of their hair, but also with regard to managing different disease states. This is a review of different artificial intelligence tools that may help you in a variety of different areas. When I first heard artificial intelligence, the word artificial is enough to tell me I don't want it, right? But that's a little short-sighted. And even though I'll be 72 in a few days, I have a very open mind as an old man. And they do a very nice job looking at diagnostic tools, product recommendation tools, growth and treatment monitoring tools, and surgical planning and visualization tools. And they go through a variety of different developers, the different AI tools they have, and looking at where they are at right now and where they might be beneficial. So I think this is another great example of where the Journal of Clinical and Aesthetic Dermatology is looking at a variety of different areas and trying to bring all of us up to date in many different important areas of dermatology. So I'm very proud of the journal, my colleagues so far, our new managing editor, Dylan Bailey, and her associate editor, Michael Wong, who has come on, and others at the journal are doing a fantastic job. So looking forward to March, but that's the end of February 2026, the JCAD issue. Thank you very much for listening.